Indeed. Thank you so much, John.
You're welcome.
And if you have ever laughed, sneezed, or exercised and felt something wasn't quite right, well, you're not alone. Joining us now are Dr. Teresa Baker from Texas Tech Physicians, OBGYN, and also Ashlee Crawford, a pelvic floor physical therapist from Texas Tech Physicians, to talk about pelvic floor physical therapy and why it matters. And I am excited to learn about this because, yeah, I've heard about the pelvic floor, but I haven't really dove into this topic. And of course, we had to bring in our experts here. So I want to start off with you, Dr. Baker. Can you tell us a little bit more about the pelvic floor? Like, what is that?
Yeah, it is kind of hard to wrap your brain around, but we think about, there's a group of muscles called the levator plate that is sort of like a hammock that sits underneath your bladder and your rectum.
Okay.
And it helps everybody, men and women, just when they're standing upright. But when you think about all the things that happen in a woman's life, just age alone can do it. Chronic cough, but also childbirth and carrying a pregnancy can do damage to those muscles. And so Ashlee and her group have really changed the way we think about pelvic floor and rehabilitation after any injuries or any kind of change in your pelvic floor and what that can mean for you long term.
Right. Okay. And now, Miss Ashlee, what kind of symptoms can we see when these muscles aren't functioning as they should?
Well, with pelvic floor dysfunction, we see a wide range of symptoms because, like Dr. Baker said, it has so many functions throughout the day. So multiple people can come in with pelvic floor dysfunction and it can look different for everybody. So we see some patients come in with urinary incontinence or leakage, or bowel incontinence or leakage, but we can also see the opposite side of the spectrum, people coming in with difficulty with urination or trouble emptying their bladder completely, or constipation. We see patients with pelvic pain, difficulty with exercise or daily activities because they have pressure from like a prolapse or things like that. And so with the pelvic floor, how it functions is the coordination of it. And so a lot of times women don't know, or men, how to utilize their pelvic floor the best way. And so a lot of times in physical therapy, what we work on is coordinating the muscles and so that they can use them and help with those symptoms. So with other muscles like your bicep, you can see it activating and resting, but with the pelvic floor, since you can't see it, you don't get that visual feedback. And so we're just working on coordinating, strengthening, or we see tightness at the pelvic floor just like anywhere else. And so we're able to work on those things and address the symptoms that people may have.
Okay, I see. Very informative. I'm so glad that y'all are here today. And for those that are interested about this topic and want to learn more, Dr. Baker, where can we go for more information?
We have a lot of information on theinfantwrist.com. It really has changed a lot of our thoughts about long-term female health, but also males have been helped by this a lot. And there's a lot of ways that, it's striated muscles that you can strengthen if you just learn how to use them correctly. So it's really changed our field quite a bit.
Wow. Well, thank y'all so much for, shedding light on this topic. Thank y'all, Dr. Baker, and also Ashlee, for being here today. We appreciate it.
You're welcome.
Of course. And stay with us. We have more Studio 4